Okay, we're going to test the left ilium position. Talking about a left leg that appears longer. It's because this hip has rotated forward anteriorly, okay, or you've had a shift up in your right side. So we're going to check the left hip here and see what kind of range of motion we have in this position. It's a self-test you can do. So I'm going to lay Dee Dee on her side. We're going to take that top leg, left leg, and we're going to bring it up on to a bench or something where you can actually create a little bit of stretch into the main hip flexors, okay? So keep everything at about 90 degrees, all right, if you can. So here, as well as the bottom leg, the right leg. First, just relax your leg completely, okay? Get your hip so it's not in this anterior forward position, because that's probably how it's going to appear. So I want you to posteriorly tuck, so you're tightening your abs and your glutes a little bit. Stay in this position and let the leg relax if you can. We'll see if it can, how well it can drop down. It should be able to drop fairly well, but this, you can see we have a big gap here with DDS because she's got a little more anterior tilt on this side, and it's a pretty common issue. So check that first, and this is helpful. You can also go to the other side and see the difference, and probably on the right side it will be less than that, okay? This is a positive test for this. All right, so first thing, just think about squeezing the knees together. Turn your toes inward a little bit. There you go, okay? Now, posteriorly rotate your back, tuck your pelvis flat. There you go. So you're slightly lifting your pelvis up. And I want you to squeeze your hamstrings. Pull this heel, your heels slightly towards your glutes as you lift your hips up just a little bit. Just hold that, okay? Make sure you contact the adductors and squeezing that foam roller. Okay, don't go too high, it's perfect. Breathe deep through your nose, out your mouth, okay? Now from here, to activate that left hamstring a little bit, take your right leg and elevate it straight just in front of you, about 2 inches. Hold, good. Keep breathing. Perfect. This is for a stretch in the hip joint region and the gluteal area. So you're gonna just put your feet against a wall or a beam, at like a right angle. You're gonna cross one leg over the knee, okay? And this may be really tight, so you may need to back up, but what you're trying to do is just cross this and feel a little stretch into the hip joint region, okay? Like I said, if it's too difficult, you can move your body back. Go and move back a little bit, Dee Dee, okay? That takes some of the stretch off, and then you can also move forward until you feel a nice stretch in that region. The whole idea here is so that you're not having to use your upper body to stretch this area. You're using the wall and the leg crossed here. So it's a passive stretch. You're just holding for a bit, maybe 30 seconds, and feeling that stretch. The next component of this is more